I'm Nicholas Kolaitis. I'm from University of California, San Francisco, and I am an assistant clinical professor with a focus on lung transplantation and pulmonary hypertension. My interest in advanced lung disease and pulmonary hypertension transplantation started when I was at UCLA for my residency. I worked in a hospital that did a lot of transplants, and so you got exposed to what life is like before and after transplant, and to see the change in a patient's life is what set me on this path. I then had a mentor, Rajan Sagar, who does transplant and pulmonary hypertension, and essentially wanted to model my career after him. From there, I went to fellowship at UCSF, where I worked with our transplant team led by Steve Hayes, and then Teresa DeMarco was my PH mentor, and so trained in both transplant and PH, and it's just been an incredible field for me. ISHLT has given me opportunities for presentation to a large audience of both my research as well as in the symposium format, and that allows you to then be recognized and seen, so then you get other opportunities presented to you because somebody sees you present, and then when they think about that topic for another conference or another presentation, they ask you. I think the biggest advice is get involved and submit. There's no reason why you can't come up with your own symposia. There's no reason why you can't submit it. It is likely that if you have a good quality abstract, it could end up in a podium presentation. ISHLT in particular is a society that tries to bring up the early career members. You know, one of the things that ISHLT always says when you're submitting a proposal is focus on gender, focus on geography, and focus on generation. And the idea of focusing on generation is particularly important in this society. And so if you get involved, you will get brought up within the society.